Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning.
Good morning. Did
Good
you
morning.
see the sunrise again?
Yes.
Beautiful.
And this 4th of July weekend, you know what we're going to talk about?
Oh, what we can talk about is...
It's all about the spot, about the spot. Oh, baby, it's all about the spot, about the spot. Oh, baby.
Well, wait a minute.
That's it. I'm done. I'm out of here.
Wait a minute.
There was a taste to that.
You
There
wanna
was
do
an
the
introduction.
Well, wait. Before we do this, Dr. Mencia, I want to, because you're very good at history, tell me how this whole thing with the spa came about. Not for you, but, years ago, we didn't have spas. The spas were in Germany and other kinds
Right.
of places. How did this all happen?
If really, like you said, people would have to go out to very exotic countries and get a spa type of treatment. In Hawaii, growing up in Hawaii from a young age, I remember a lot of tourists will come there, and then the hotel are right by the beach because they are small islands, and people will get their massage right there by the beach,
Right, and they
10
come for a
o'clock
week,
at night,
right?
and they will
they
come for a week, like a
rejuvenation.
retrieve to relax the body and the mind.
Okay, so now, what happened that all of a sudden, it isn't just going and getting your hair done or your nails done. There's a lot more. And as a physician, you must really understand the difference of a person who needs that kind of relaxation and what it does for your patients.
Well, if we look at our body, the largest organ that we have is the skin. And it's a very complex organ. And it's just like your liver, your heart. And what people notice when they will go and get acupuncture, acupressure, get a massage, they come and they say, wow, but when I'm back at work, I don't feel rejuvenated anymore. So that's why the spa started growing into the city and become part of our way of life, because we want to feel better after work, and we want to maintain our rejuvenation. And a lot of my patients, they ask me, like, how you keep your skin like this?
That's right. For those of you who haven't seen Dr. Mencia, his skin is gorgeous like a baby.
Yeah, and I use my products. I listen to, when I go and I get my treatment, I use products that will help my skin stay youthful. And it takes, it's an effort. If you don't take care of your skin, it's like if you don't take care of your heart, if you don't take care of your liver, if you eat the wrong food, you can develop an ulcer in your stomach. If you eat the wrong food, you can develop pancreatitis. I mean, all the organs can go wrong when we don't take care of them. And the skin is one of those organs. It happened to be the largest one.
Well, and the one thing that impressed me about you is that you decided to get a spa, make it into a medical spa. You are such a busy person, and here you're doing that. And now,
well, something, I didn't decide to get a fellow my lab, and it's really, I'm very close to this particular one. As a matter of fact, Ina will tell you, I think it was about 2 or 3 years ago, a friend of mine from Canada, she was relocating, and her husband owned a large car dealership, and they wanted to just relocate. And because we were friends, they said, Dr. Mencia, why don't you take over my spa?
like added to all the
And
other
it's
things
really
you do,
close
right?
and it's very close to my office. And I declined. I went, me and Ina went there. We look at the place, and we said, no, we don't think so. But this particular one, Stonewater, my kids, they grew up there. They grew up going there. When they became teenagers, they used to get their eyebrow done, and they would go and get their nails when they were, young kids, get their nails. 2 girls I have, so, they will go and get their nails
A lot
done.
of history
And,
for you, wasn't it?
and I would like, scream at them. I say, I just pay for your nail to be done. And they go home and they paint a
Right.
different colors. We just pay for this.
Right.
But anyway, but I grew up there in Stonewater. It's, it has such a great reputation.
Well, it isn't
That
just
the
small.
owner, no, it's
Large.
Yeah, it's a large place. And the owner was relocating to Las Vegas. And he is my patient. And he said, Dr. Mencia, I'm really trying to sell this spa. I cannot find a good buyer. But you will be such a great match because you do aesthetic.
Yes.
And I said, okay. So again, we go there with my manager. We take a look. Of course, it was a lot of work that needed to be done. It was very abandoned. It needed a good manager. It needed good staff. A lot of the old staff that were there, they left because of poor management. And I say, if the first thing, because everything had to be done in phases. So the first thing is the house had to be cleaned up. And I told Ina, before we get a manager, we have to clean the house.
I just have to stop you because
if I would have brought
It's
Olga
like-
there the
right.
way it was,
No.
she
Wait,
would walk out the
It's
other
like
door.
I would have cleaned it out too.
Everything you do is like give it to Ina. I just have to say,
Yeah.
let Ina do it, right? And that's why Ina's like has too much to do, and I keep asking her. So what's happening in the spa? She said she shakes her head. It's too much. It's too much. So Ina, but you're so good at
she's
so
a
many
trooper.
things.
She's a
That's the
trooper.
problem. You're
Yeah.
too good.
Yeah.
Once you're good, then give her Ina more, right?
Yeah.
But
Now
I
Putin was going to ask for her to go back to Russia,
Yeah,
and I
right.
said, over my dead
That's
body.
right, over my dead body too.
And Putin said, with pleasure.
Don't let her go anywhere. So, Ina, this is a wonderful thing now. I had the pleasure of meeting this beautiful woman, Olga Pardo, this morning. So how do you feel about all this?
Oh, I feel very excited. I'm so excited. As a matter of fact, we interviewed Olga, right? And
After
then-
you interview so many people.
Yes, we went through so many people, and then we interviewed her, and that was my longest interview of my life. It's been over the hour, and we've been just talking and she's so interested because of her experience, where she's coming from, what she used to do. And we just talk, and I'm like, look at my watch, and I'm like, oh my Olga, that was the longest interview in my life.
But you knew.
But I enjoyed it. We both enjoyed it. It was very, very good. And then she said, well, I think I like what I hear. I want to join you guys, but I need to give a 2 weeks notice to my employer.
The longest 2 weeks for Ina.
That was the 2 longest week of my life. And I was so afraid that she might change her
Yes.
mind because it's a long period of time. Anything can happen during those 2 weeks. I don't know, maybe they're going to give her something better.
Right,
This
right.
and that. And I was like, oh my God. And I go like with my nails on my
But
desk.
once she met you and she met Dr. Mencia, of course, he had to approve. He's the one that, when he knows people, and he could
Right.
probably know in a minute, right?
Yes.
So once that happened, she's not going anywhere. I
No.
can tell you.
No.
The two of you are like, magic. So now we have Olga here at the radio show.
Good morning.
Good morning. And gee, Dr. Mencia, this is a great asset to your organization.
Yes, like I tell you, I think I always listen to God advice. And God had blessed me with excellent physicians that work at the medical center. And when the spa fell on our lap, I thought, just be patient. God will guide us through this, and we're going to find the right person. And I am so impressed by Olga that I told Ina, just let her take the spa like it's her own spa.
Yep.
Let her run it.
I've only been with her 20 minutes, and I get that same feeling. We talked about things, and it turns out that I just have to share this. In the cover of our June issue is a very famous woman named Iris Epfel. I don't even know her, but I know she's famous, and so I decided to do a story on her. So I'm showing the magazine to Olga, and she said, are you kidding? That woman, and she is very famous. She's big time. She's like Jackie Kennedy in a sense from up in New York. And she said, oh, she only wanted me to do her shampoo her hair. I said, you're kidding. I mean, so that's it. She's in. So Olga, so tell us, what are we going to see at the spa?
Definitely good energy. I think that there needed to be a definite cleaning of the house, and just get the morale up again. I think with a lot of changes, that makes people a little bit weary of what the future holds. And the first thing I wanted to do was definitely build a rapport with the people that are there. I need to gain their trust, and I need to let them know that I'm here for you and the business to make it work and make you all succeed.
But you have a lot of experience, and I
Yes.
think. And what is your background? That people would like to hear that, I'm sure.
Well, I'm gonna age myself by saying that
okay,
I
we're
have
we're
over
all-
30 years. Well, you'll help me with a little, I've been in the industry for over 30 years. I'm a licensed cosmetologist in New York as well as Florida. I've done education. I'm on the board of directors on the American Beauty Academy. So I try to stay in touch with all aspects of the industry because I love mentoring. I love teaching. I've had amazing mentors throughout my career. When I first started, I was just a shampoo girl,
Like
a
all
Frederick
of us.
Fekkai,
When we first started,
all the
you
way in
know.
the bottom. But it does
Right.
teach you a work ethic that when you do get to the point, that you've succeeded, you know all the hard work that it took to get there.
So tell me, so if someone comes to your spa, tell me
Yes.
all the wonderful things that could happen.
There-
Stone Med, let me keep saying that name so people understand it. It's called the NNSA Med Spa, which is different than a regular spa because you have Dr. Mencia, who is the medical director. But the official name is Stonewater Med Spa.
Correct.
Right?
Yes.
So tell us, if I walked in, what would happen?
You can walk in one way and you're going to leave completely a different way because there's absolutely nothing that we don't offer that will help you with relaxation, with your health in some ways, because relaxing is definitely very healthy. Hair, skin, massage, nails, different kind of treatments, body wraps. So basically, you can walk in there in the morning, spend the whole day there, and leave completely a new
You gonna
person.
buy me lunch?
Why not? I made friends with the restaurant next door. I got you.
I got you covered.
Yes, I got you covered.
Okay, you have it covered. But now, how about? I'd like to talk more about that salt bath. We talked about it when you first came in. Have you ever done that?
I have not. I have not.
And I have not either. Maybe we should do this
let's
together.
go. Ladies,
Have you
do it.
done it?
No.
Let's all go. The three
Let's
of us.
have a
Let's
halo
have
therapy
yes, let's
party.
have a salt bath.
There you go.
But I heard about salt bath, and maybe Dr. Mencia can talk a little bit about the benefits of something like that.
I have not done it either. But,
Oh, well, now I'll tell
but
you,
I
if you're
did
a good
my
boy, we're
research.
going to let you go.
I did my research.
Do we have to get all our clothes off to get in there? Or can we do it in a bathing suit?
You can do it in
Yes.
your bathing
Okay,
suit,
bathing
yes.
suits.
Yeah.
Okay.
But basically, what the concept is, like when you go to the Dead Sea, the Dead Sea is full of salt. And a lot of people with skin condition and health issues will go to the Dead Sea and just sit and surf there. And the salt that you are inhaling, and it's going through your body when you go inside the Dead Sea, is therapeutic. And people say, like, oh my God, I went all the way down to the Dead Sea. But like we said at the introduction, we are bringing this into the city. So it's a chamber. It can be a room. It can be a room like this one. We can create it to produce the same therapy, and a lot of people can sit together. But this is more private, where one person at a time use the chamber. And you have this concentrated salt being blown into the chamber while you are sitting there for 20 minutes. So after I did my research, I say, and remember, all of this, was paid for. It's not like I have to use it so I can pay my lease, or it's paid for. So it's just sitting there. So I did my research to see what was good and what's not good, so we can get rid of whatever, was not going to give us a good reputation. And I did my research, and I say, this is good. This is really good. It's good. If you think salt, if you are taking salt into your sinuses and inhaling salt, it should be good for your body because it take all the mucus out of the sinuses and your lungs, and you should be cleansed. And not even when we take an inhaler, when you have asthma, most of them don't go all the way down to your lung. But if you're sitting for 20 minutes, it's like when you get on one of those breathing machines. that is blowing the smoke that you inhale. That goes down to your lung. So I say, this thing makes sense to me. So I like to put it to the test through my patients. So I would tell my patient, when you go there, I want you to try it, but tell me what you think about it. And I wouldn't tell them that I bought the spa or nothing like that. I say, I want you to go to this place, try the salt water, and the salt bed, and tell me what you think about it. And one particular, my representative from one of the pharmaceutical company, she came back to me, and I forgot I told her about it. She came back to me, say, Dr. Mencia, I went to the spa. I said, oh, great, how was it? She said, I sat on the salt bed, and they put a chamber on for about 20 minutes. And I tell you, when I got up, not only my skin felt so smooth, but I could breathe so much better. And my daughter is asthmatic. So I asked my daughter, come in, I want you to get a treatment. So she brought her daughter and got a treatment, and the daughter fell in love with this machine. And she said, oh my God, Mom, I can breathe so much better. She was so happy because this is not an inhaler. A lot of times, these inhalers are chemical that you're putting into your lung. They are steroid that you're putting into your lung. Then you become dependent on the steroid. You have to take it for life. So this is something natural. And they fell in love with it. Say, just for my daughter's sake, I'm so happy. So they bought a package, and
Well, I promise you, now this may be coming week because I finished with a July issue. I'm going to go do that. But let me say something. Since you started this, I've been noticing there's an organization up in West Palm Beach that only does salt baths.
Yes. So, yeah.
So, I mean, this is becoming very important.
Very popular, and there are not too
Yeah.
many around. We have one here in Boca. There is one downtown Fort Lauderdale. There's us. There's if you Google salt bed treatment, there are not too many in the area, in all of South Florida.
Well, I want to do it because I want to be able to do some research on it and really do an article on this, even without in yours. I just think it's really important. Because after I have a massage, the massage service says take a hot bath and in with salt.
Yes.
Mm-hmm.
And I do that. So,
Right.
And she said it's going to relieve your muscles. So there's got to be something to this.
It is, and basically it's like going to the Dead Sea, but taking the benefit of sitting on the Dead Sea to home, and you don't have to get on the water. You stay dry, but you see the salt on your body when you come out of the chamber.
And so you have a shower there and people
Yeah,
wash
right.
themselves off and all, right?
Oh, and then you have the
Vichy shower.
Vichy shower.
What's
Ina
that?
tried that one.
Okay, what's a Vichy shower? What's a Vichy shower?
Oh, that's a Vichy room, which is used for body treatments.
And I was gonna get rid of that room.
No.
Yes, and Dr. Mencia wanted to get rid of that room.
No.
Well, what
And I
happens in
said-
that room? What
And I said, let me go and try, because one of employees said, you have to come and try it, and then you decide what you want to do. And I never have time. And she goes, you have to go, you have to go, you have to go. So one day I came, and she gave me treatment, which was a body exfoliation first, which you can use if it's for deep exfoliation. They use the one with salt, and for more minor ones, they use sugar. So I use
Sugar.
sugar scrub to
Because the abrasive
exfoliate
helps
your
a little
skin.
And then you just lick your arms?
You can
No, I'm
lick
just
if you want to.
But you didn't use the sugar, did you?
No,
You
Because
use
you're too
salt.
sweet
I'm
already.
too sweet already.
Right.
It's too much.
So
Yeah.
you use salt.
So I use salt.
I want to do all
caramel
that.
and salt.
I'm going to do so if I go, so that would be part of the little program I have?
That will be a nice package to have.
Yes.
And
So you do the salt also in the other, both of them?
yes, you
Wow,
do.
That would be so cool.
Yes.
I like that.
In my opinion, it's better to do probably the body treatment and then to go to the salt bath.
Yes.
Or, go on.
Okay, so you have a package, Olga, now that someone comes in, they say, what can I have as a package? You have different packages?
It really depends on, we cater to their needs. If they want to spend the whole day in the spa, then we can add longer services. So if they get a standard pedicure, it's a little bit shorter, but if they get the spa pedicure, it's a little longer. So it depends. If they just did the facial massage, manicure, pedicure. Sometimes they just want manicure and pedicure and facial. So we cater it basically to, to what their needs are and how much time they can actually spend in the spa. Now then, those are the basics, which would be facial, massage, manicure, and pedicure. But if they wanted to add different treatments, like the Vichy shower or the salt chamber, then we can go ahead and incorporate that as well.
This is really very powerful. I am very excited about what's happening here. So let's give
Pencil
a phone
talk.
number. Yeah,
Pencil talk.
Pencil talk. Let me just do this. So everybody write this phone number down because you want to call and make an appointment as soon as you can. It'll change your life. 954-561-8799. Remember, get your pencils out, get your paper, and don't do this in a notebook. Otherwise, you'll lose your paper. No more of these little yellow stickies. It's 954-561-8799. Now, they're located at 2767 East Oakland Park Boulevard in Fort Lauderdale. And Dr. Mencia, of course, is the medical director, so they're really doing some fabulous things there. Oh, and also, you just were telling me, remember we had Dr. Ruskin who was here.
And we have an article that she wrote on the last issue in June.
Right, and she wrote about that, so she'll be there also. Do you have to make an
She
appointment?
already started. You have to make an appointment with Olga so that Dr. Ruskin will line up her patient. She's an active
Special
practice.
treatment. It's called
Vagina-
Thermiva. And it's
Termiva.
vaginal and
all about the
vulvar
spa.
rejuvenation using controlled radio frequency energy. And this is going to make you
For
pretty
the
all
vaginal
over.
vaginal rejuvenation.
Wow.
And she's practicing,
Yes, gynecologist.
actively practicing
Yes.
gynecology. She does surgery. So you do have to make an appointment at the spa.
And she has an office in there when she comes.
She
sees you in a-
comes to my office and she does the general gynecological exam for female.
Yes.
But when she comes to the spa, it's just the spa treatment.
Okay. You have expanded so much.
That's
this
leaving
is-
new, huh?
Yeah, he's been. But that's one thing about Dr. Mencia. You'll notice he wants to know about everything. Anytime I find something that's a little bit new, which I just have, and I'll talk to you later about it, I always bring it to Dr. Mencia. Is it good? What do you think? And sometimes he does well, and sometimes he says, no, it's not a good thing. I don't want to do it.
I used to be a consultant for Channel 4 and Channel 10 for the news. So whenever there was something coming new to the consumer, they would ask me from my expertise, the medical point of view. And of course, then you have to do on your research, the new thing. So you go and research and look for the pros and the cons, so that when you go in the news for 30 seconds or 2 minutes, that you can tell the consumer if there are benefits, if this a hawk or this real, and so on. So I'm used to researching things and see what's useful. And I can tell you, we get so many people that come and they try to sell this to us and do this and it's interesting. I met a lady that told me about the treatment that you guys are doing with the water on the feet.
Yes, the
Ionic
foot
bed.
detox.
I know
Foot
about
detox.
that. I've done that.
Ionic.
Ionic
had
bed,
that
food
20
done it.
years ago. I've been doing 20 years ago. Someone came to me and I tried it. You should see what came out of my feet.
But something this lady was telling me, because she has a person in South Carolina that she's an expert at this. And I told her, if that lady ever come down, I want her to meet my manager at Stonewater. Because she was saying it's not only doing it, but you have to analyze. You have to analyze the water.
Oh,
Yes.
So
I didn't
you
know about
analyze
that.
the water. And she said, I go to this lady in South Carolina, and she goes, "You were sleeping on your left side last night." And she had to stop and think. And I say, she goes, "Yeah, how do you know?" "Well, your liver didn't get if." And she's going through this thing just looking at the color of the water, because she has liver issues. And it's interesting that by the time we discovered the liver issue, they have discovered this with the ionic water.
Yeah, the ionic water is wonderful. Are you going to do the ionic water? Because
We do
do
it.
it.
We do
Oh,
it.
see,
that one I
I
did.
really believe
I
in
did that
this.
one.
Oh, but But wait a minute. So she could tell out. So if you're sleeping on your right or your left, that there's a part of your body that's not getting something.
It's not
So
getting
should you be lying flat?
oxygenation.
Is that?
Oh, absolutely.
I didn't know that.
For many years, if you see Asia, the Asian, they tend to sleep flat on their back.
Okay, you know what? We have to stop.
No,
Then we have another half an hour.
Okay, lock the door.
No. We'll be right back. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.